burns are most common as well. So what will you do if there is burns? So what are burns? So burns is, that means you have exposure to the heat, the chemicals, electricity, or any radiation. So critical burns, that means you have trouble breathing. You have trouble in breathing, and then it covers more than one body part. Okay, it covers more than just one body part, not just from this area, but it should be covers more than one part of the body. So it covers the eyes, that is critical as well, and then genital parts. So that is critical, and if the victim is elderly, what do you mean when you say elderly? So that is older, so 60 up, so elderly. So what are the first aid treatment? Cool the burn immediately by immersing it in cool water, not ice, or placing it in a cold running water for at least 10 minutes. So, and then use a clean, cool, wet towel will also reduce the pain. And for minor mouth burn, victim can suck on the ice. It's not swallow, only suck. Okay? And then next, if there is severe burns, what you will do? Do not remove pieces of cloth that stick to the burn. Okay? That is the first thing you are going to do. Do not remove the pieces of cloth that is stick to the burn. Number 2, do not try to clean the burn. Okay? And number 3, remove the jewelry. Okay? Remove the jewelry distal to the wound. Example, you get a burn here. So you have to remove your jewelry. If you have watch, you have rings, you have to remove that jewelry distal or away from the part of the wounds. And then tell the victim where you put the jewelry. Of course, you have to put it from her or his belongings, not yours. Mind that. Okay. And then lastly, you have to cover the burn with dry, sterile, non-adhesive dressing to separate the toes and the fingers. Okay? The shock, what you are going to do is to lay the victim flat on the surface. Lay down flat on the surface, and then you have to elevate the feet 12 inches. So 12 inches, you have to elevate the feet if there is shock. So, and then maintain the normal body temperature, and then you have to monitor the breathing, the circulation, and bleeding until the help arrives or until the rescue team will arrive. So for choking, choking is most common, especially for the children. So what you are going to do if you are in a scene, for example, you are eating in one of a fine restaurant, and then the one beside you or in the another table was choked. What you will do for you to talk? So if victim can cough or talk at all, leave them alone. Okay, leave them alone, but stay close, and you have to encourage them coughing. Okay, you have to encourage them to cough and cough until the objects inside his or her mouth will come out. So that's it. So nothing to worry, as long as the victim can cough or talk at all, you can just leave them alone. Just stay by their side, stay close, and then encourage them to still continue coughing until the object will come out of their mouth. And then if their hands are at their throat and they cannot speak, you have to call the 911. Okay, if their hands are at their throat and they cannot speak, that means it's emergency. You have to call the 911 or the rescue team, and then you perform an abdominal thrust. So what is abdominal thrust? That is a first aid treatment for choking. So for adult or child over 1 year old, you can perform this. So call emergency team first. You have to call emergency team, and then identify yourself and ask them if you can help. Okay, you have to get consent first. For example, hello sir, I'm Joy and I am a healthcare provider. Can I help you? So you have to ask for consent for that person or for the guardian. So do not let a coughing person go away by themselves to the bathroom. You have to accompany that person. And then when doing abdominal thrust, stand behind the victim. Not in front of the victim, but behind of the victim. And then wrap your arms around the victim's waist. You have to wrap your arm around the victim's waist. If too big, if the person is too big, he is obese or pregnant, wrap your arms under the armpits. Okay? Armpits. And do the chest thrust. If they are too small, have them kneel. Okay? Have them kneel. And then, if they are very short, or if it is a child, you should do the kneeling as a healthcare provider. So, abdominal thrust. What you are going to do, you have to make a fist. You have to make a fist. Place the thumb side of your fist in the middle of the victim's abdomen. So place the thumb side of your fist in the middle of the victim's abdomen and just above the navel and well below the breastbone, and grasp your fist with your other hand like that. So below the this is the navel, and this is just above the navel here and below the breastbone. So put this here and this, okay, and then keeping your elbows out like that, and press your fist with a quick upward thrust into the victim's abdomen. Each thrust is a separate attempt to clear the airway, like that. 1, 2, 3. So not like that, but it should be a separate attempt. 1, 2, 3, like that. And then continue performing this maneuver until the obstruction is cleared or the victim loses consciousness. Okay? You have to continue performing this maneuver until the obstruction is cleared or if the victim loses its consciousness. If you are the one who is choking and you are by yourself, you have to dial from a landline. You have to call for help. Okay? And then get out where someone, okay? Get out where someone can see you so that someone can help you. And then use the back of the chair. Okay? You can also use the back of the chair or a table corner to give yourself abdominal thrust. Okay? So if there is a chair here or a table corner, you just have to adjust and then you can perform an abdominal thrust by yourself. Okay? Do not panic. Just don't panic so that you know what you are going to do. So if victim becomes unconscious, what you're going to do is you have to position the victim on the back and then check the mouth to see if the object is still visible, and then sweep it out with your finger if you can. If it is visible, you can sweep it out with the use of your finger. And then you have to pinch the nose shut. Pinch the nose shut. Tilt the head back. Cover their mouth with yours and perform the CPR if the victim is unconscious. You have to lay him back and then check if the mouth or the object is still visible, and then you have to squeeze it out using your finger, and then pinch the nose, tilt the head back, cover the mouth with yours, and then attempt to ventilate. Okay, if unsuccessful on the first try, reposition to open airway and then try again. If you still cannot ventilate, do abdominal thrust. Okay, so abdominal thrust for unconscious victim. What you will do, you have to straddle the victim's thighs. Okay, and then place the heel of one of your hands against the middle victim abdomen and just above the navel and well below the lower tip of the breastbone, and then place your other hand on the top of your fist hand and give up the 5 quick inward and upward thrust. Check the victim's mouth and do a finger to remove the object if it has been dislodged. So if breathing has not been restored, open airway and attempt to give 2 more breaths. Okay, and then if breath won't go in, give another series of up to 5 thrusts, check mouth and ventilate, and then continue this sequence until the help arrives. Do not stop. Okay, so rest. So this is a way to breathe air into someone's lungs when they stop breathing. So besides airway obstructions, there are other causes of lack of breathing. So what are they? So poisons or drugs, injury to the chest or lungs, that is why you are having a difficulty of breathing, and then near drowning, electrocution, or you get electrocuted, and then burns, certain diseases or illnesses, allergic reaction to insect bites or stings or food, shock, heart attack, or heart disease. So that is what you are going to do if you are going to rescue the breathing. So please guys, I hope you like this video. Please don't forget to like and subscribe.